Hi, everybody. It's Brad Truax here from Eastman's Woodlands and Wildlife Committee. And today we're going to do an annual update on ticks. And it's particularly important because we're expecting that the tick season in 2026 is going to be considerably worse than the one we had in 2025. So, again, it's that time of year again. We're starting to do more outdoors now that the snow is melted. But that also means that the ticks are going to be out and about. And once again, we suspect 2026 is going to have a lot more ticks than a relatively quiet year that we had in 2025. So again, we're all aware that tick bites can cause an increasing number of diseases, and that's because the ticks transmit bacteria, viruses, and parasites. And diseases like Lyme disease being the most common one we hear about, but you can also get Powassan disease, babesiosis, ehrlichiosis, Rocky Mountain spotted fever, and a number of others. The black-legged tick, also known as the deer tick, is the primary vector of Lyme disease in most of the United States. And remember, ticks can't jump and they can't fly. Basically, you get tick bites when they crawl onto you when you come into contact with something they were living on, like a grass blade or a leaf litter. And they can't bite through clothing. You live at Eastman, you're going to be exposed to ticks. So you better know what to do to reduce your chance of getting one of these tick-borne diseases. Now, again, Bebop Labs collects data on ticks in New Hampshire, and they found that 40% of black-legged ticks carry at least one disease, like Lyme disease, and about 7% actually carry more than one disease. And that number is actually probably up over 50% now. In Vermont, over 50% of ticks have also been found to carry at least one disease since 2013. So, so why do I say that 2026 is likely to see more ticks than 2025? Well, 2025 was originally predicted to have an increased number of ticks, but we recall very few ticks actually last year. I can only recall having to remove ticks from my skin maybe once or twice all last summer. That was very unusual. And probable reason for that was the prolonged severe drought that we had. Remember, ticks really like moisture. Ticks do very poorly when it's dry and hot. They actually need lots of moisture. So that prolonged drought that we had probably accounted for a relatively quiet year for ticks in 2025. On the other hand, 2025 was what we call a mast year for acorns. Now you might be asking yourself, what do acorns have to do with ticks? Well, the bottom line is that when you have a mast year for acorns, the following year there's going to be an increased number of mice and squirrels and voles and other animals that feed on acorns. Okay, so in that following year, which would now be 2026, the white-footed mouse, which is the primary vector or the primary host for most cases of Lyme disease, they're going to increase in number. And obviously, the tick population that feeds on those mice is going to go up as well. And more ticks means more ticks with Lyme disease, which means an increase in Lyme disease in humans as well. So once again, we get back to that incredible cycle of the oak tree and the acorns. The cyclical nature has incredible implications for our whole ecosystem. So once again, 2025 was a vast year for acorns. So beware of an increase in the number of ticks here in 2026. Different ticks are associated with different diseases. The black-legged tick, the deer tick, which is the one we're most concerned about with, is associated with Lyme disease, Powassan disease, babesiosis, anaplasmosis, and a relatively new syndrome called Borrelia miyamotoi disease. The Lone Star tick, on the other hand, is associated with ehrlichiosis, bourbon virus, Heartland virus, and an interesting syndrome of red meat allergy, also known as the alpha-gal syndrome. And I'll talk a little bit about that later on. The dog tick, on the other hand, is associated with Rocky Mountain spotted fever. And winter ticks don't cause disease in humans. Once again, winter ticks have a devastating effect on the moose population here in New Hampshire and Vermont. And we refer you to our presentations on moose for details about winter ticks. So here's the black-legged tick. Even though dog ticks are much more numerous than black-legged ticks in New Hampshire, it's the black-legged ticks that are far more likely to cause disease in humans. And white-footed mice and white-tailed deer are the primary animal vectors or hosts for tick-borne diseases here in New Hampshire. The Lone Star tick is rarely found in New Hampshire. Ticks do have a life cycle. The deer tick life cycle is about 2 years, and there are really four stages. The eggs have to be laid, then the larvae hatch, nymphs will later hatch, and then finally the adult stage. And once the tick is hatched, it needs a blood meal. So again, the nymph usually feeds on a small ground-based mammal, typically a white-footed mouse, and the adult feeds on its typical host, the white-tailed deer. So the nymphs are actually most likely to transmit most tick-borne diseases, perhaps because they're so small and they're hard to detect, so they're much more likely to bite you. So here's graphically that cycle. So here you see the eggs being hatched. Out here you see larvae come up. They feed then upon a ground-based mammal like a white-footed mouse. Then you get the stage where the nymphs come out. And remember, the nymphs are actually the ones that cause much of the human diseases. The nymphs then will bite another animal. Here it shows a dog, but most likely going to be another white-footed mouse. Then the adults get hatched, and they will feed upon their host, which is the white-tailed deer. So once again, adult black-legged ticks can climb vegetation, so they can get up as high as a meter. So they're much more likely to latch onto a deer that's passing by. So this is one that's showing the relative size of ticks, and this is important. The big tick here, that's a dog tick. Okay, they're fairly easy to spot. The Lone Star tick, which we don't have many of here in New Hampshire, has this little white spot on its back. That's why it's called Lone Star. It's almost as big as the dog tick. But the ticks we're concerned about with are over here. These are the black-legged ticks. This is the adult. But look down here. This is the nymph. Now, remember I said that the nymphs are associated with much of the diseases we see. So look how small that tick is. Okay, the ticks aren't very big. Sometimes you'll just feel them crawling. That may be the first clue that you have a tick. But a crawling tick hasn't yet bitten you. But if you find one tick crawling on you, it probably means there are others as well. So let's watch this video to see just how small these ticks are and where they go.
Can you spot the deer tick? In spring and summer, nymph stage deer ticks are hidden in leaves, in the woods on the ground, even around the edges of your yard. They latch on and crawl up, undetected, often under your clothes. Prevent this from happening by tucking pant cuffs into your socks. It's a bit unfashionable, and sometimes hard to get people to do. The newest and most reliable way to prevent tick bites and disease is to simply wear tick-repellent clothing with permethrin.
So that's pretty good advice, but you could see how small that tick was, and again, their natural proclivity is to look for places under your clothing to latch on. New Hampshire is actually a top 5 state for ticks. Deer ticks typically have 2 high seasons. They start coming out in March, the season peaks in May, then there's a lull in summer, and a second spike that occurs in October. Dog ticks, on the other hand, have just 1 high season. Their season runs between April and August and peaks in June. And once again, the deer ticks are far more likely to transmit disease than the dog ticks are. And remember, ticks may be looking for a meal anytime the temperature is above freezing. So you have to be aware any time of year, even in winter when you go out. The ticks may be in the leaf litter. And even though they slow down their activity when it gets cold, unless it's freezing, they can still bite you. So here's graphically the tick season. The blue down here shows the dog or the black-legged tick or the deer tick, and you can see they're coming out now. They're going to peak in May, and then there's just going to be this lull over the summer, but then a second peak that occurs out here in October. Whereas the dog ticks have a peak out here in June. So have ticks become more frequent? Quite frankly, I can't remember ever being bit by a tick when I was a youngster, or in fact, not even seeing a tick. Uh, and many people knew about Rocky Mountain spotted fever, but it was really only when Lyme disease was discovered in 1975 that we began to hear a lot about ticks and about tick-borne diseases. Ticks definitely have become more popular since that time, and there are a number of reasons. The changing forest ecology probably played a big role. And again, what happened in the past was that lumbering and farming and fires kind of prevented overgrowth of old forests. So you had a lot of new growth. There wasn't a lot of you had not a big overstory, so you're able to have a lot of dry understory. Okay, so the sunlight was reaching the floor of the forest, and there weren't very many moist plants there. Now remember, it's critical for the tick to have moist leaf litter or other moist plants to be able to thrive. But as the forest matured, now we have big overstories and lots of leaf litter, and the floor of the forest is very moist, and that's ideal habitat for the ticks. And the second factor might be that the natural hosts for the black-legged ticks, that's the white-footed mouse and the white-tailed deer, have also increased over time. So there are a number of reasons why ticks have become more frequent. So Adam Haritan of Learn Your Land has a very good argument about the role of fire in the evolution of ticks. He points out that Native Americans used prescribed fires extensively for many years. And the U.S. government switched its strategy for fighting forest fires. At one time, it was active fire suppression. Okay, so they would try to put out every fire. Now they changed to a strategy that creates more fire resistant forest systems. And if they're fire resistant, that means that they're much more likely to have moist plants, which, as before, is something that the ticks need. So that transition from a dry, fire dependent ecosystem to a moist, fire resistant ecosystem is actually called mesification. And remember, ticks need moisture. Wetter, fire-resistant forests are great habitats for ticks. So maybe Adam actually has a point here. Very interesting. So again, you can go back and actually watch that video. Climate change in ticks. Climate change clearly has had an impact on tick population and tick-borne diseases. In New England, our winters have been much milder. They are shorter with less snow cover. Ticks are not killed by cold. Instead, they just become less active. So ticks are being active earlier in the year and later in the year because of those shorter winters. And here's an example. In Maine, over the last 3 years, cases of Lyme disease have more than doubled, mainly in the mid-coastal region. And the officials there ascribe this to the ideal conditions for the ticks: wet, humid weather in winters that didn't get as cold as they were in the interior. So perhaps two other trends could conceivably stem the tide to some degree. I mentioned before the severe drought that we had last year probably reduced the tick population. So if we get another extended drought, that could do it. And number two, more forest fires. So back to that argument we just talked about the forest fires. Okay, once a tick is on a person, it can feed for several days. And as it feeds, it fills up with blood and gets bigger. And it's in that stage that it can transmit diseases to humans. So you want to find a tick and remove it before it reaches that stage. And after feeding, the tick will eventually drop off. But knowing what it looked like, mainly how big it was when you remove it, that's important because it may help determine whether you need to be treated with antibiotics to prevent Lyme disease or any other tick-borne disease. So where do ticks live? Once again, they like warm, moist places, especially at the interface where lawns meet the woods. And there's actually a zone between the woods and your backyard that's about 3 meters or 3 yards wide. That's called the tick migration zone. And over 80% of the tick nymphs actually are found in that area. Long grasses, shrubs, and bushes are also favorite places for ticks. But moist leaf litter with an overstory of trees is kind of their ideal habitat. And the black-legged ticks are far more numerous in the woods than they are in the grasses. And once again, animal vectors, not just the deer and the white-footed mice, but other rodents and skunks and fox and bobcats and so on can also carry ticks as well. You live at Eastman. You live in the woods, you go hiking, you golf, you're going to be exposed to ticks. So you better know what to do if one bites you. So the enemy of the tick is drought or anything that causes dryness. Tick needs moisture and they're vulnerable to desiccation. Again, desiccation means drying. And that's actually why we put our clothing in a hot dryer after exposure. More on that later on. The prolonged drought that we had in the summer of 2025 likely caused us to see fewer ticks than usual last year. And once again, ticks are vulnerable to freezing, but they can survive in leaf litter through other cold temperatures. So again, be careful even in the winter. Ticks don't run after us. They'll usually climb up on vegetation and wait for us to walk by, and then they grab on when we do. Deer ticks don't eat native plants or leaf litter or brush piles. They tend to stay in brushy areas or leaf litters because they need that high humidity or moisture. But they do eat mammals, or at least the blood of the mammals. And two of their favorites are the white-footed mouse and the white-tailed deer. Okay, remember I said ticks can't fly? Well, they really can't fly. But research showed that static electricity allows them to jump and latch on. So let's watch this little video. Wow. So that tick was crawling, and all of a sudden, static electricity caused it to jump up to somebody's object. So this is showing, remember I mentioned the tick migration zone. So most of the ticks are out here in the forest, in the woods. This zone here, roughly 3 yards, 9 to 10 feet, is where over 80% of the tick nymphs will exist. So you want to make sure a couple things. Number one, many people suggest putting wood chips out here at the edge of the forest. Some also talk about stone walls and wood piles out here. I would suggest against those for two reasons. Stone walls and wood piles are favorite areas for white-footed mice and other small critters to thrive. So I wouldn't recommend those. But the key thing I want to point out here is two things. Any recreational things like a swing set, you want to make sure is inside that tick migration zone. Same thing, if you have a garden, you want a garden that's going to be deer resistant, okay? Because you don't want the deer coming in there and bringing ticks with them. You want to make sure that it's also inside of that tick migration zone. So once again, because the black-legged ticks favor those mice and those deer, if you have a very simple landscape and only white-footed mice and deer, you're going to have high rates of infectivity. But if you landscape to encourage more diverse mammals, more diverse mammal population, you could reduce the chance of getting Lyme disease. Okay, so areas that have more foxes and chipmunks and squirrels and raccoons, groundhogs and opossums have much lower rates of Lyme disease. And it's not because they have fewer ticks, it's that those mammals are dead-end hosts for Lyme disease, as opposed to the white-tailed deer and the white-footed mouse, which can transmit the disease. By the way, that last one was from Doug Tallamy. If you haven't read his book, Nature's Best Hope, I strongly recommend you read that. It has great information about what you should be doing with the landscape around your property. So again, understanding those migration zones can be important. Again, if you have a 3-foot barrier separating the forest from the living areas, and you could line that with wood chips or perhaps some rock. And again, a further 9-foot barrier should separate the wood chips from your play areas, your gardens, your patios, etc. And any play sets should be located in those safer areas and preferably in sunny areas because, again, the ticks don't like the dry, sunny areas. And very importantly, many commercial companies can treat the perimeter of your property with pesticides that kill both ticks and mosquitoes. I personally have the perimeter of our property sprayed probably 5 or 6 times a year with a pesticide for tick and mosquitoes. So again, this is just showing that slide again. The tick migration zone here for it's about 9 feet wide. Back here is where you would put the wood chips. And again, you want to make sure that your swing set or other recreational tools are inside this zone. And the same thing, your garden should be inside. And your garden preferably should be one that's not going to attract white-tailed deer. It's also interesting that certain invasive plant species are probably good for ticks. Ticks are more abundant when you have understory plants like Japanese barberry, bush honeysuckles, and common buckthorn. It's not clear why, but there are at least a couple theories. The humidity levels around Japanese barberry may be ideal for ticks, and dense thickets of barberry also are good hiding sites for mice, and white-footed mouse, again, is the prime vector for many tick-borne diseases. Researchers in Vermont and Maine are actually looking to see if reducing invasive plants will end up reducing ticks. So how do you avoid tick bites? Well, first of all, if you can avoid an area where you expect ticks, don't go there. But quite frankly, because you live in Eastman, you enjoy the outdoors, so you're going to be in areas where there are ticks. So you need to wear light-colored clothing, and that's so you can better see any ticks. You need to wear long sleeves and long pants. Make sure you tuck your shirt in. Tuck your pants into your socks, like we saw in that video, or wear gaiters. Make sure you don't go walking around in sandals or going barefoot. If you have long hair, tie it back and wear a hat. And use permethrin on your clothing and your shoes when you're going into areas that are likely to have ticks. Or you can wear some of the clothing that's pre-treated with permethrin. Now, there is some data to suggest that very high exposure to permethrin or pyrethroids may have a mortality effect, but you really have to be exposed to a lot. You should also spray your exposed skin with DEET 20% or greater. And keep in mind that for children, you shouldn't use DEET that's more concentrated than 30%. And once again, you want to do a thorough tick search after you walk in any areas that are likely to have ticks. Search your pets for ticks before you let them in the house. And know how to best remove any ticks that bite you. So what about ticks when you're hiking? Well, the same recommendations about clothing and tick repellents that we just talked about apply when you're hiking. But you want to hike, when you're hiking, you want to stay in the center of the trail as much as possible. And that's because the ticks tend to be in some of the higher grass that might be on the side of the trails, and you might be a little bit more likely to have one latch onto you there. But keep in mind that the ticks also like moist leaf litter. So you can still get tick attachments even when you're right in the middle of many of our trails. You do want to avoid tall grasses if possible. And always do a thorough tick search after you're hiking. Are you a golfer? Well, when it's warm and you're out golfing, you probably don't wear long sleeves or long pants or tuck your pants into your socks when you're golfing. If you're like me, you probably hit some golf balls into the woods, and you likely leave the fairway to look for your golf ball. And those areas of the woods that are just off the fairway have lots of leaf litter, and that means they have lots of ticks. So moist leaf litter is a great home for the ticks. I've sometimes found 4 to 6 ticks on my exposed skin simply after looking in the woods for a golf ball, only a few yards in for not more than a couple minutes. So again, they're definitely out there. You want to have a high suspicion for ticks when you're going out there. So make sure you search for ticks whenever you look for your golf ball in the woods. Okay, so you want to do that tick search after you walked in those areas. Look for ticks all over your body, even on your back, your neck, your hairline, your groin, your butt cheeks. Deer ticks like bare patches of skin that are near the waist or near sock bands or anything that's tight. They may also get between your toes. So you want to search your pets for ticks before you let them in the house. You should remove your clothing when you come in and place it in a hot dryer for at least 20 minutes if possible. And first, it's important, don't wash those clothes first. You want to first put them in the hot dryer. And that's because, remember, ticks like moisture. So it's the hot heat, hot, dry heat that kills them. So don't wash them first. Put them directly in the hot dryer for 20 minutes. You can always wash them later on. And if you can't place your clothing in a dryer right away, you can put it in a sealed garbage bag for later drying. Then you go take a shower and look for more ticks. And if you do find a tick, use the tweezers to remove the tick by grasping the tick as close to where it's attached to the skin as possible and pulling straight up. Don't twist because, again, that may break off the mouthpiece of the tick. Okay, then you want to wash the area with soap and water and maybe a mild disinfectant or antibiotic ointment. And you may or may not want to save the tick. We'll talk about that in a minute. So where do you especially want to look for ticks? Well, the scalp, the neck, the hairline, by the ears, the back, underarms, around your navel, the waist and the hips, your pelvic area, groin, even your butt cheeks, between your legs, behind your knees, and down by the sock lines. So these are favorite areas for the ticks. You may even want to look between your toes. So are you a tick magnet? There are certain traits that make people more attractive to ticks. Hot, hairy, heavy breathers tend to be tick magnets. The ticks are attracted to heat and carbon dioxide, so people that have higher body temperatures and those that are exhaling very forcefully are at greater risk. And if you have hairy legs and arms, those create perfect leg holes for the ticks to grab onto as you brush past them in the woods or on the edge of a field. And there's probably also an X factor. Some people release greater amounts of the chemical pheromone called butyric acid, and that tends to attract the ticks. So much better to be a chick magnet than a tick magnet. So how do you remove a tick? Well, in most cases, a tick has to be attached for 36 to 48 hours or more before the Lyme disease bacterium can be transmitted. So knowing how to correctly remove that tick is important. And you don't want to leave the tick's head embedded in your skin. And there are certain myths of things used for tick removal that don't work. That would be fire, alcohol, nail polish, and Vaseline. So don't use any of those. So again, the tweezer method is the best. There's also the wet Q-tip method, which I'll also describe for you. And there are certain tick remover tools. So once again, grasp it with a fine tip tweezers as close to the skin as possible. Pull upward with a steady, even pressure. And don't twist or jerk the tick because, again, that may break off the mouthpiece. And after you remove the tick, clean the area and your hands with rubbing alcohol or simply soap and water. And if the tick is alive, you can kill it by putting it in rubbing alcohol or placing it in a sealed bag or container. And you might want to save the tick. Again, that would be primarily so that they can verify that it's a black-legged tick and see how big the tick is, because the degree of engorgement may predict the likelihood that you might get Lyme disease and help make a decision about whether you should be treated with antibiotics or not. And some health departments actually discourage saving the tick because it sometimes delays treatment. Sometimes the tests are inaccurate. And quite clearly, you may have been bitten by more than one tick. So here's the method. Let's watch this.
Let's face it, most of the insurance industry can feel a bit prehistoric, impersonal, and confusing.
There's the old way and the right way to remove a tick. This isn't the right way. Neither is this or this.
Using matches or nail polish remover or Vaseline, you want to avoid those.
Dr. Bobby Pritt is a parasitic diseases expert at Mayo Clinic. She knows ticks and how to properly remove them.
You don't want to squeeze the tick because that could cause it to regurgitate some of its stomach contents into the wound. You don't want to burn the tick. That could also cause it to regurgitate.
Dr. Pritt says the best tool for the job is a fine-tipped forceps or tweezers. Without squeezing the body, use the tweezers to grab near where the tick is attached to your skin.
You would just pinch as close as you can to the bottom of the tick and then just pull it out in a single continuous motion. The goal is to remove the tick as fast as possible without damaging it.
Dispose of the tick in a sealed bag or container, or flush it down the toilet. Then clean the bite area and your hands. For the Mayo Clinic News Network, I'm Jeff Olson.
Okay. So here's the alternate tick removal method, and I like this one. You use a wet Q-tip. Okay, wet the Q-tip, twirl it around the tick several times, gently touching the tick. And the tick may dislodge from the skin with its mouthpieces intact. So after removing the tick, again, clean the bite area in your hands with soap and water or rubbing alcohol. And you can kill that live tick by putting it in rubbing alcohol and place it in a sealed bag or container like we saw in that video. And once again, you may or may not want to save the tick for species identification. I actually like this alternate method, and I usually try this before going to the tweezer method. And that's simply because if the tick gets out on its own, you don't have to worry about it leaving its mouthpiece attached to your skin. So let's watch this video.
Okay, I'm going to take a video on how to remove a tick that I got yesterday cleaning out my garden. You see it? Mm.
Yep. Right there. Just go in circles. A little bit of water. You sure this was on from yesterday?
Yeah.
No, he's not even barely in there very far. Just go around in circles like that. Oop, there you go. See, and then they let go. That's it. Just like that.
Pretty neat. Once again, I actually prefer that method. I'll try that before using the tweezers if I happen to have it available. There are also some tick removal tools that are inexpensive. You can get them almost anywhere on the internet. They're probably actually better suited for moving ticks from your pet rather than from you. But the idea here is that you're supposed to align the large hole over the top of the tick. Okay, you then pull backwards with a steady pressure. Here it shows somebody removing a tick from a dog. And once again, I might use this only if I don't have access either to the wet Q-tip or the tweezers, and I happen to have one of these tools on my keychain. So again, it's a third method that might be considered. So if you're bit by a tick, first of all, don't panic. The key is to remove it as soon as possible. You usually don't need antibiotic treatment after a tick bite, but if you live in an area that has frequent Lyme disease, you need to contact your physician to decide whether an antibiotic prophylaxis is indicated. And once again, we do live in an area that has a high percentage of Lyme disease ticks. So you also want to watch for a fever, rash, or a flu-like illness in the weeks after a tick bite, because that might be a sign of Lyme disease. And other symptoms of Lyme disease might include headache, muscle aches, joint swelling or pain, even sometimes neurological symptoms like facial paralysis. So again, Lyme disease is caused by the bacterium Borrelia burgdorferi, and it's transmitted by the black-legged tick or the deer tick. So here you see it in a deer. And these ticks reside in both deer and in white-footed mice. So these are the two major vectors for Lyme disease here in the United States. So Lyme disease often begins with a classic rash. It's a circular red rash that actually looks like a target. I'll show you a picture in a minute. And again, fever or flu-like illness might come on a few weeks after the tick bite. And other symptoms might be headache, muscle pain, joint pain, neck stiffness, fatigue. And it can affect, in later stages, joints, the heart, and the nervous system. It can cause arthritis. It can cause carditis, that's inflammation of the heart. So you might get palpitations or an irregular heartbeat. And some people may get neurological symptoms like a facial paralysis or a severe inflammation of the brain and the spinal cord. So here's that classic rash that I talked about. Doesn't that look like a target? So here you have a circular red area. It's a little whiter in the center. Then you have another whiter area outside, and then another red area outside that. So it looks like a archery target. Now, Lyme disease can be prevented if you get an antibiotic following a tick bite. So there are certain circumstances where you may want to be treated prophylactically with an antibiotic. A single dose of doxycycline, which is an antibiotic, can lower the risk of Lyme disease under these conditions here. So one, the tick bite occurred in a place where you have a high incidence of Lyme disease, such as New Hampshire. The attached tick can be identified as either an adult or a nymphal black-legged tick. And the estimated time of attachment was greater than 36 hours, based upon how big the tick was, because the tick got engorged from eating blood. And you want to use this antibiotic if you can get it started within 72 hours of removing that tick. And the patient obviously has no contraindication to that particular antibiotic. And these are recommendations from the CDC. So again, here's that classic Lyme rash. So a little whiter in the center, then the circular area of redness, followed by another white zone, and then another red zone. So again, it looks like a classic archery target. Now, there are actually a whole bunch of rashes that can occur with Lyme disease. I'm not going to bore you with these, but if you want to look at the pictures, you can look at those on the PowerPoint presentation that'll accompany this on the Eastman web portal. One other disease that's caused by the black-legged tick is the babesiosis. It's caused by a microscopic parasite. And the symptoms, this is, again, now endemic here in New Hampshire, Vermont, Maine, and Massachusetts. And the symptoms are fever, chills, headache, loss of appetite, fatigue. And this tends to be worse in people who are older or people who are immunocompromised, or interestingly, in people who lack a spleen for whatever reason. Anaplasmosis is another disease associated with the black-legged tick. This one is a bacterial disease, and the symptoms are fever, headache, and nausea and vomiting. And once again, it's also worse in people who are either older or immunocompromised. And it can also cause anemia, a low white blood count, low platelet count, and some abnormal liver tests. And in a severe case, it might even lead to hospitalization or very rarely death. And this is treatable with antibiotics. The newest tick-borne disease is Borrelia miyamotoi disease. This was only recently recognized. It is carried by the black-legged tick, and it's caused by a bacteria. And once again, its symptoms are actually similar to several of the other diseases: fever, chills, muscle aches, joint pain, headache, fatigue, and it is treatable with antibiotics. The most severe condition associated with ticks is probably Powassan disease. This was named after a disease that was first recognized in Powassan, Ontario. And it is carried by the black-legged tick, rarely by the woodchuck tick or the squirrel tick. And it's probably the most serious of the tick-borne diseases. The tick bite doesn't have to be prolonged, whereas for Lyme disease, the tick has to be there for 36 to 48 hours. Powassan disease can be transmitted in as short as 15 minutes. And it's a virus that gets transmitted, and that virus can cause meningitis or encephalitis. So again, inflammation either of the brain or the spinal cord. And the symptoms usually begin between a week and a month after the bite. And the symptoms are fever, headache, vomiting, weakness, confusion and memory loss, loss of coordination, speech difficulty, seizures. And ultimately, this can be fatal People who have severe disease, as many as 10% may die. And about half of the people who survive severe disease may have some long-term health problems like recurring headaches or loss of muscle strength or memory problems. And unfortunately, there are no medications to prevent or treat Powassan disease. It is a viral infection, and antibiotics don't treat the viruses. Now, here's a disease associated with the Lone Star tick, ehrlichiosis. That's named after Dr. Ehrlich, who first recognized the condition. It's caused by a bacteria, and symptoms usually start within 1 to 2 weeks after a bite by the Lone Star tick. And symptoms: fever, chills, muscle aches, headache, vomiting, diarrhea, confusion, eye redness, and maybe a rash. Rash is a little more common in children. And this happens to be much worse in the young and the old. So children under 5, adults over 65, and again, those with a weakened immune system. Those are the ones most likely to have severe disease. And very rarely this could be fatal, but fortunately, very rarely. And it is treatable with antibiotics, so it's important to make the diagnosis. Okay, spotted fever rickettsiosis. This is a group of diseases caused by a group of bacteria called rickettsia. And the most well-known is Rocky Mountain spotted fever. These are pretty rare in New England. The symptoms usually begin 3 to 14 days after the bite of the dog tick or the Rocky Mountain tick. And the symptoms are fever, headache, and a rash. Rash, again, more common in children. But that telltale rash usually develops 2 to 5 days after the fever starts, and it usually begins with small red spots on the wrists and the ankles, and then spreads to the limbs and the trunks, and sometimes the palms and the soles. So here you see all these spots. That's why it's called spotted fever. And there's often a dark scab that's left at the site where the tick bite actually occurred. And the illnesses can range anywhere from mild to life-threatening, and they are treatable with antibiotics. There are a couple non-infectious tick-borne diseases. One of them is tick paralysis. The other is red meat allergy, which we'll talk about next. But tick paralysis is caused by a neurotoxin that's secreted in the saliva of a tick. And that tick is it's usually the gravid female wood tick. That's Dermacentor andersoni. And most cases occur early in the year, usually between April and June. And most cases, interestingly, are either in young girls, primarily because they have long hair, or in men who have outdoor jobs, like lumberjacks or people that are out in the forest doing work. And it presents with an ascending paralysis, and it may even paralyze the respiratory muscles. So it may mimic Guillain-Barré syndrome, which is an autoimmune disease where you get an ascending paralysis. And removal of the tick results in reversal of the symptoms within hours or within days. So you have to especially look around the scalp for a tick in those cases. This is one of the true miracles we see in medicine. So if you saw somebody who was out in the woods, whether they had a history of a tick bite or not, and they had an ascending paralysis, you want to do that thorough search, especially around the scalp. And if you see the tick and remove the tick, their paralysis may disappear within hours. Truly a medical miracle. Okay, the second non-infectious condition associated with tick bites is the red meat allergy. And this is associated with the bite of the Lone Star tick. There are a couple cases that have been associated with other ticks, but overwhelmingly this is associated with the Lone Star tick. And it's much more serious than just causing allergy to red meat. You would confirm this by having an allergist actually do what's called a challenge test. But if that challenge test showed that you had this condition, it's important that you avoid not just red meat, but a whole host of other things. There are various drugs, vaccines, even sweets, and even toothpaste that can have mammalian cells or tissues, or even a minor quantity quantity of gelatin that can cause a reaction. So it's very important that if this is recognized, it's not just avoiding red meat, it's avoiding several other things. Even things like their intravenous immune therapy agents that use some monoclonal antibodies, like infliximab, that also have to be avoided in patients who have this syndrome. So again, what is it? It's triggered after somebody's bitten by a tick carrying alpha-gal, which is a sugar molecule in its saliva. Now, the alpha-gal molecule is present in the muscles of almost all mammals, the exception being humans and some primates. Okay, so what happens? Your immune system, when it recognizes something that was not part of your body, it will create an immune reaction to fight whatever that thing was. So again, here the human immune system detects this alpha-gal molecule as something that's foreign. So it's going to create an immune reaction to that thing. So when you eat red meat and that antigen is exposed, your immune system will react to it. And the onset of the alpha-gal system is usually 4 to 6 weeks after a tick bite, but it may only appear several months later. And some people can't even remember being bit by the tick. The symptoms that occur when you eat red meat come on usually 1 to 6 hours after eating the meat. And the symptoms can range anywhere from mild, like a rash or swelling or some abdominal discomfort, to severe, including difficulty breathing and anaphylaxis. Anaphylaxis is when your blood pressure drops out and you get cardiovascular collapse. So again, at least one fatal case has been described. I don't want to bore you with it, but two things that were interesting from that case. The initial symptoms are mainly gastrointestinal. And number two, the victim didn't remember any tick bites, but did recall numerous chigger bites around his ankles. And it turns out that what are mostly called chiggers in the eastern United States are actually larvae of the lone steer tick. I did not know that before. And again, those chiggers are fully capable of sensitizing somebody to that alpha-gal molecule. There are a couple other ticks you probably should be aware of, the Asian longhorn tick and soft ticks. They're probably not going to affect anybody here in New Hampshire, but if you did find somebody who had a condition related to these, it was probably because they traveled outside the area. So here's the Asian longhorn tick. It's an invasive tick, first discovered in 2017 in the United States, but it's now found in at least 20 states, including New Hampshire, although pretty rarely here. And it's known in other parts of the world to transmit diseases like anaplasmosis and babesiosis, but so far we haven't seen any diseases transmitted by it in the United States. But the problem is that they feed on numerous animals, including cattle and humans, and they will be hard to control because this particular tick reproduces without mating. So even one tick can lead to an infestation. So this is maybe a threat for the future. Not currently, but something we need to keep our eyes on. And then there's this interesting thing called soft tick relapsing fever. There's a tick that occurs out in the west and the southwest called the soft tick. And it causes a bacterial infection that leads to a fever and illness that's cyclical in nature. So it's often called tick-borne relapsing fever. And these cycles are recurring. So you get 2 to 7 days of a high fever and shaking chills, headaches and muscle aches, sometimes a rash. And the cycle is 2 to 7 days, and then you get 4 to 14 days without any symptoms. And these cycles can repeat themselves over and over, as many as 10 times. And it's usually contracted in people who have been in some rustic old cabins in the western U.S. or southwest U.S., usually cabins that were rodent infested, or in caves in those areas. And so anybody who came up with this in New Hampshire would be likely somebody who traveled to one of those western states or southwestern states and stayed either in a rustic cabin or was visiting caves out there. So again, here's the soft tick down here, and the victims usually don't even recall the tick bite. It is treatable with antibiotics like doxycycline. Okay, tick-borne diseases have more than doubled in the U.S. since 2004. You can see they've significantly gone up. You do see some fluctuation, though. Okay, so why might the tick populations fluctuate? Well, we mentioned before how if you get a period of extended drought, that can reduce the tick population, at least temporarily. And we also talked about those boom-bust cycles of the acorns that lead to a fluctuation in the white-footed mouse population and subsequently the tick population. I also just want to say, even though we're talking about ticks coming up in the summer, don't forget they can still be out there in winter. They're not killed by the cold, they just become less active. So you can still get bit by a tick even in winter. They'll burrow down into the leaf litter, and the snow may actually help keep them warm over the winter. So only when it's below freezing can you be sure that you're safe from the ticks. And with climate change and shorter winters, ticks are getting active earlier in the year and staying active later in the year. Can anything be done to reduce tick populations? Well, we talked about things at the landscape level. Again, you could remove any non-native plants like Japanese barberry. Culling the deer population will cut down on the tick population. You could let chickens or guinea fowl roam your property. Well, you can't do that at Eastman because it's not allowed to have chickens on our property. But you can use pesticides. Again, I mentioned many commercial companies will spray for both ticks and mosquitoes. And desiccation by any means. So if you can dry things out, that's effective. Yeah. How about prescribing fires? Well, we're not going to do that here at Eastman. That might be something that's used elsewhere, but not here. And how about earthworms? Okay, some people have suggested that earthworms can reduce the tick population by removing the leaf litter that's essential for those nymphs who are overwintering in the leaf litter. One of the problems there, though, is that most of these worms we're talking about are non-native species, and they could have some other negative ecological impacts. There are a number of great resources on ticks. You can go to the UNH Cooperative Extension. Tick-Free New Hampshire website is a good one. The CDC, which has those guidelines I talked about. There's something called the Tick app, which you could have for your iPhone or your Android phone. New England Journal has a very good article, a video on ticks. And I mentioned before, the Bebop Labs website has some really nice posters that you can download. So you could go there. And they actually have done a publication in a peer-reviewed journal on ticks here in New Hampshire. So again, I like this sign. We don't have this. This actually comes from Cape Cod. But again, the tick warning is don't let one bite change your life. So it's important that you understand the threat that ticks pose and know what to do, first to avoid tick bites, but second, know what to do if you do get bitten by a tick. So that's our update for ticks on spring 2026. Hope that you've got something out of this, and we'll see you again soon.